you wake up multiple times during the night to urinate? Is your urine stream weaker than before? Are you concerned about prostate cancer? Many men wonder if their masturbation habits affect their prostate health. As a urologist with 20+ years of experience, I'll address this relationship based on current scientific evidence. Hello and welcome. If this is your first time visiting the channel, I'm so glad you're here. This is a space where we talk openly and honestly about health, aging, and all the things no one else dares to say out loud, especially after 60. If you haven't already, take a moment to hit that subscribe button and turn on the notification bell so you never miss a new video. And if you find this video helpful, please give it a like and share it with someone else who might need to hear it today. Now, let's talk about something a little personal, shall we? You're 70 and masturbate daily? Don't be ashamed. It's not weird. It's wise. For some, that sentence might feel shocking. For others, it's simply the truth. Either way, this video is here to remind you, there's nothing strange, shameful, or inappropriate about staying connected to your body at any age. In fact, it might be one of the wisest things you can do for your health and emotional well-being. We're going to explore this topic gently and honestly, with no judgment, just real understanding. And hey, if there's anything in this video that doesn't sit right with you, or if you think there's something we could do better, please leave a comment. Your feedback means the world, and it helps us create content that truly serves you. Now, take a breath, get comfortable, and let's have a real talk. One that might just change how you see yourself and your body from here forward. Part 1. The prostate's critical role. The prostate, though only walnut-sized, is a crucial control station for the male reproductive and urinary systems. It produces about 30% of seminal fluid and essential enzymes for sperm survival. Its position surrounding the urethra below the bladder means any enlargement directly affects urination. This explains why approximately 50% of men over 50 and 80% of men over 80 experience prostate issues. Part 2. Masturbation, beneficial or harmful? Is masturbation harmful to my prostate? Patients often whisper in my clinic. The answer isn't simply yes or no. The impact depends on age, frequency, and overall health. A landmark Harvard study following 30,000 men over 18 years found that those who ejaculated 21+ times monthly had 33% lower prostate cancer risk compared to those ejaculating only 4 to 7 times monthly. This benefit was primarily observed in men over 50. The proposed mechanism is prostate cleansing. Ejaculation helps flush out potentially harmful substances and abnormal cells. Think of it like maintaining plumbing. Regular use prevents stagnation. Part 4. Warning: moderation matters. Like most health factors, there's a Goldilocks zone. Both too little and too much can cause problems. I've treated many patients with chronic pelvic pain following periods of high-frequency masturbation. Some research suggests very frequent ejaculation in young men, 20 to 30, might actually increase later aggressive prostate cancer risk. Each body responds differently. Some men maintain high frequency without issues. Others experience discomfort even with moderate frequency. Listen to your body. Pain, fatigue, or urinary discomfort after masturbation suggests adjusting your frequency. Next, the 30-day NO masturbation challenge. Facts. Many patients ask about no-fap challenges seen on social media. From an evidence-based perspective, no reliable scientific research proves abstinence benefits prostate health. In fact, some evidence suggests regular ejaculation benefits men over 50. However, many challenge participants report psychological improvements. This could be placebo effect or from replacing masturbation with other positive activities like exercise or social engagement. Consider such challenges as self-awareness exercises rather than medical treatments. How about BPH and masturbation? Benign prostatic hyperplasia, BPH, affects nearly half of men over 50 and 90% of men over 80. Symptoms include frequent nighttime urination, weak stream, and incomplete bladder emptying. Some small studies suggest regular sexual activity, including masturbation, may help reduce certain BPH symptoms by improving pelvic blood circulation. However, BPH treatment requires a comprehensive approach of lifestyle changes, medications, and sometimes surgery. Masturbation can complement treatment, but isn't a primary therapy. I'll tell you the truth: ejaculation and prostate cancer risk. The Harvard study mentioned earlier shows frequent ejaculation associates with reduced prostate cancer risk, particularly in men over 50. Ejaculation may help clean the prostate by removing potential carcinogens. However, masturbation is just one factor affecting cancer risk. Diet, genetics, family history, and environment also play important roles. Regular sexual activity can be part of an overall prostate health strategy, but doesn't replace regular checkups and PSA testing. Let's talk about this: sexuality and mental health in older men. Sexual activity triggers endorphin and oxytocin release, reducing stress and improving mood. University of Michigan research found men over 60 with regular sexual activity reported 41% higher life satisfaction. For elderly men living alone or who have lost partners, masturbation provides a healthy connection with their bodies and natural sexual needs. This shouldn't be stigmatized as age inappropriate. And clinical recommendations I want you to digest now. For men over 50 without specific prostate issues, moderate masturbation 2 to 3 times/week may benefit prostate health. Listen to your body. Any unusual symptoms warrant medical consultation. Get regular prostate examinations, including PSA testing. Maintain overall healthy lifestyle, vegetable-rich diet, regular exercise, weight control, limited alcohol, no smoking. Discuss sexual health openly with your doctor. Don't let embarrassment prevent necessary medical support. Sexual health remains an important aspect of overall well-being at any age. Age is just a number. Health and happiness are what truly matter. Here's the conclusion: taking control of your prostate health. As we've explored throughout this discussion, the relationship between masturbation and prostate health is nuanced but important to understand, especially for men over 50. The research provides valuable insights that can help you make informed decisions about your sexual health and prostate care. Key takeaways to address your concerns: moderate ejaculation 2 to 3 times weekly appears beneficial for most men over 50, potentially reducing prostate cancer risk by up to 33% according to Harvard research. This prostate cleansing helps flush out potentially harmful substances. Listen to your body signals. Discomfort, pain, or urinary issues after masturbation suggest adjusting your frequency. Each man's optimal frequency differs based on individual physiology. BPH symptoms, frequent nighttime urination, weak stream, can often be improved with a comprehensive approach, including regular sexual activity, which promotes blood flow to the prostate region. Balance is key. Both excessive frequency and complete abstinence may be suboptimal for prostate health in older men. The sweet spot varies by individual. Important precautions: any blood in urine or semen requires immediate medical attention. Persistent pelvic pain warrants professional evaluation. Sudden changes in urinary patterns should not be ignored. Individual responses vary. What works for others may not work for you. Your next steps: schedule your annual prostate exam if you're over 50. Track your symptoms in relation to your sexual activity patterns. Have an open, honest conversation with your healthcare provider. Consider making dietary improvements that support prostate health: tomatoes, green tea, fatty fish. Integrate regular moderate exercise into your routine. Remember, prostate health isn't just about sexual habits. It's part of a holistic approach to aging well. Regular exercise, a plant-rich diet, stress management, and adequate sleep all contribute significantly to your prostate well-being. Don't let embarrassment prevent you from addressing these important issues. Millions of men face the same concerns, and healthcare providers are trained to discuss them professionally. Your prostate health is too important to ignore. Take action today for better health tomorrow. Before you go, remember that prostate health affects nearly every man as he ages, yet too few discuss it openly. If this video helped answer your questions about masturbation and prostate health, please take a moment to subscribe to our channel and hit the notification bell so you never miss our evidence-based health discussions. Share this video with the men in your life who might benefit but would never search for this topic themselves. Sometimes the most important health information is the hardest to talk about. Comment below about your biggest takeaway or any questions you still have. Your engagement helps us create better content and builds a community where these crucial topics can be discussed without stigma. What would you like to see next? We're planning upcoming videos on the prostate diet, foods that fight inflammation, sexual health after 60, what changes to expect, BPH versus prostate cancer, symptoms men confuse, medications that secretly affect your prostate. Your health journey matters to us. Let's continue the conversation.